Remember to subscribe to our YouTube channel at NDN Nigeria. Click on the subscribe button and be the first to get notifications. Niger Delta Development Commission, NDDC, making a difference.
Over 3,000 persons in Imo State received medical attention for various ailments during the NDDC's free healthcare mission at the AKUGHA General Hospital in AKUGHA local government area. Our correspondent reports that the team, which performed over 300 surgeries, went to Imo State following a successful outreach in Akwa Ibom State after the recent reactivation of the region-wide medical program.
In remote communities of the oil-rich Niger Delta region, the Niger Delta Development Commission's signature free healthcare initiative has become a crucial lifeline to the poor and vulnerable populations, often representing the only medical services available to this population. A worthy example of this troubling condition in the region was at AKUGHA, Imo State, where Mrs. Kate Ewim's son urgently needed hernia surgery, but the family could not afford the procedure until the NDDC's free medical mission provided the vital care, alleviating her son's prolonged suffering.
If NDDC didn't do it for us, we don't know how we are going to do it. It's God that knows.
Another beneficiary, Mrs. Ogbonna Nneka, who endured jaw dislocation for months, now looks forward to regaining a normal facial structure and smile, all thanks to the NDDC's timely intervention.
For the past 4 months, I've been suffering. I've not been chewing. I hardly close my mouth, but during this treatment that I came on Tuesday, by the mercy of God, I was able to close my mouth. And the teeth that refused to join together, I was able to join together. If not for this opportunity, I wonder what would have been the case.
For his part, the paramount ruler of AKUGHA, His Royal Majesty Eze Nani Chinedu, while commending the NDDC for the initiative, said its impact in his domain was unprecedented.
In fact, it's so impactful that I'm not sure anybody will want to rival what they have done. Nobody will come near it. No matter how free it is, this one is something else.
NDDC Director of Health and Social Services, Dr. George Uzowane, while conveying the message of the Commission's Managing Director, Dr. Samuel Ogbuku, to the people of Imo State, noted that reactivating the free medical program after about 5 years of hibernation is in line with the current board and management's collective resolve to provide essential medical services to vulnerable Niger Deltans who lack the means to access such care.
Before we develop any place, we must be concerned about and committed to developing the people. To heal the people is to heal the land and make it whole.
The turnout for NDDC's free medical mission in Imo State actually underscores the pressing need for more healthcare interventions in rural and hard-to-reach areas of the Niger Delta.
Niger Delta Development Commission, NDDC, making a difference. Inside the Niger Delta,